during this time, and how close you might be to an agreement.
Well, as the Premier just indicated, that's something that
Good afternoon, everyone. Welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise.
Good day. Welcome to today's update on COVID-19 in New Brunswick. Our speakers today are the Chief Medical Officer, Dr. Jennifer Russell, and Premier Blaine Higgs.
For the province this afternoon are the Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon, everyone. The COVID-19 pandemic is changing every day, and our approach to managing this disease has to change with it. Today, we have moved into a new phase of this outbreak, as our investigations have confirmed that there is community transmission of COVID-19 now taking place in New Brunswick. There are confirmed cases in zones 1, 2, and 4, and there are additional cases being investigated in other regions. So the bottom line is we are now seeing cases which cannot be directly traced back to an infection which took place outside of the province. This is not a surprise. This follows the trend we have seen in other parts of Canada, and we have been expecting this and preparing for this. While the majority of current cases remain directly or indirectly related to travel, we must respond so that we protect those most in need of protection. So that means further changes to our testing protocols, which I will speak to shortly. Today, we have 2 new cases of COVID-19 reported in New Brunswick, and this brings the total reported cases to 68. As I've previously announced, 1 individual is hospitalized and 2 cases have recovered. The new cases are as follows: an individual aged 30 to 40 in Zone 2 and an individual aged 60 to 70 in Zone 3. Les nouveaux cas sont répartis comme suit.
The new cases are broken out as follows: an individual aged 30 to 40 in Zone 2, an individual aged 60 to 70 in Zone 3.
A positive case involving an employee at the Shoppers Drug Mart in St. John. The pharmacy contacted public health officials and were given recommendations regarding environmental cleaning, and they have followed product protocols and reopened. We are advising individuals who went to Shoppers Drug Mart located at 175 Old Hampton Road in Quispamsis on the dates below that they were potentially exposed to COVID-19. So on March 18th at 3:30 p.m. to 12 a.m., midnight, and on March 19th, 11:30 a.m. to 8:30 p.m., and on March 26th, 8:15 a.m. and 11:45 a.m. 8:15 a.m. to 11:45 a.m. In addition, individuals who went to Shoppers Drug Mart located at 57 Lansdowne Avenue in St. John on the date below that they were potentially exposed to COVID-19, March 20th, 10 a.m. to 4:15 p.m., and public health is following up to identify close contacts. J'annonce aujourd'hui qu'un des cas positifs.
Today, I'm also announcing a positive case that involves an employee at Shoppers Drug Mart in St. John. The pharmacy contacted public health officials and were given recommendations regarding environmental cleaning. They have followed protocols and have reopened. We are advising individuals who went to Shoppers Drug Mart located at 175 Old Hampton Road in Quispamsis on the dates below that they were possibly exposed to COVID-19. March 18th between 3:30 p.m. and midnight, March 19th between 11:30 and 8:30 p.m., March 23rd between 8:15 a.m. and 11:45 a.m. In addition, individuals who went to Shoppers Drug Mart located at 57 Lansdowne Avenue in St. John on the following date were potentially exposed to COVID-19. March 20th, 10 a.m., between 10 a.m. and 4:15 p.m. Public health is following up to identify close contacts.
Community transmission, It is more important than ever that each and every New Brunswicker do everything they can to inhibit the spread of this disease. So each individual has to take responsibility for self-isolation when they're told to do so because of travel, because of being related to a case, a contact of a case, etc. And even if you have mild symptoms, you should self-isolate, even if you haven't been tested. So self-isolating until you contact 811 and get further instructions is very, very important. So that means stay at home to the greatest extent possible. When you leave home for work or for essential errands, keep your interactions with others brief and maintain 6 feet of personal distance between yourself and others. It means washing your hands regularly and frequently cleaning common touch surfaces like doorknobs and countertops. So if you are told to self-isolate, we know that close contacts are obviously at risk in your household. There are very detailed, specific information around how to self-isolate with other people in your home in terms of not sharing a bedroom, not sharing a bathroom, and staying 6 feet away from people at all times, coughing into your sleeve, washing your hands frequently, and disinfecting surfaces regularly, such as doorknobs and countertops. So this is what we're trying to do in terms of containing the spread of infection. And again, with the whole issue around, essential businesses being closed, people not really being encouraged to go out except to run essential errands like groceries, et cetera. It's very, very, very important. The social distancing measures, the physical distancing measures are so very important right now, including the fact that we are not allowing mass gatherings, et cetera. All of these measures have been put in place to reduce the risk of people contracting COVID-19, to reduce the risk of our healthcare system being stretched beyond capacity, and to protect our healthcare workers and our frontline staff and essential workers. This responsibility is each and every New Brunswicker's responsibility. So we are going to have more cases going forward, but by taking these actions, we can slow the spread of this illness, enable our healthcare system and its hardworking employees to better manage its impact. What is community transmission? When this outbreak began, it was relatively straightforward to track the source of infection. The first cases we saw were in people who had traveled outside the province or were close contacts of travelers outside the province or outside of Canada. And again, we saw that pattern throughout the country and other provinces. And again, it started with cases in British Columbia and Ontario, those places having the highest number of flights from other countries that were affected. So we were watching those numbers and watching the fact that these travel-related cases did have clusters of close contacts that were also part of those cases. So we knew this pattern was how things were going to go in New Brunswick, and then eventually that there would be community transmission. Again, we expected to see this. However, so here in New Brunswick, we are seeing cases that are seemingly unrelated to travel. Some of them are still under investigation. So it means that the infected persons have not themselves traveled or knowingly been in contact with a traveler. It is for precisely this reason that physical distancing measures have been put in place. Au cours des derniers jours, des cas semblants.
However, in the last few days, we have seen cases that are seemingly unrelated to travel. This means that the infected persons have not themselves traveled or knowingly been in contact with a traveler. It is precisely for this reason that physical distancing measures have been put in place.
Isolation for people who have traveled outside the province. It is why we have closed non-essential businesses and directed people to stay home as much as they can. Each of these actions reduces the situations and places where people may come into contact with the virus. Our approach has been and will continue to be protection of the public from being exposed to and minimizing the risk of contracting COVID-19. Public health nurses and teams are working daily with the new cases to trace the contacts and have them self-isolate. When there are cases of workplace exposure or other forms of exposure to the public, you will be informed, as took place during the 2019 measles outbreak. For example, when we knew that someone had been to Harbour Station during the John Cleese event, when we knew that people had been in certain taxis, when we knew that people had been to certain restaurants, etc., we always made that information public so people would have that information and know to self-isolate and watch for symptoms. Each time a confirmed case who has worked in this type of setting is diagnosed, the process will be the same. Close contacts of the cases are contacted by public health and told to self-isolate, and other colleagues or people who have possibly had a different type of contact would be told to self-monitor. Therefore, if you have not been contacted by public health, you have not been identified as someone who needs to self-isolate, but you would be asked to self-monitor if you were someone who was in a more distant contact. We remain focused on testing the right people at the right time. We do not have the ability or the resources to test every single New Brunswicker, so we have to focus our resources and our attention on the most vulnerable. Even if we did have the ability to test everyone, it might not necessarily be an effective strategy. At the national level, our conversations revolve around considering close contacts to be cases and calling them an epidemiologically linked case, et cetera, but they would be treated the same in terms of the follow-up. So, and we do expect that most people will have mild to moderate symptoms and won't need hospitalization. And certainly those people who would have more severe symptoms, who would need hospitalization, obviously that would happen. And again, if we can reduce the transmission among everybody, then we can reduce the percentage of people that would need hospitalization, it would need ICU admission. So that's why people must act as if they already have COVID-19 and protect themselves and others from contracting it. In that scenario, so we don't want people to lower their guard, and we want people to be very, very vigilant, and we want to avoid, again, anybody unnecessarily becoming infected. Our approach to this disease is evolving as the pandemic evolves. We will use our testing resources to protect those who are working hard to protect us, and those who are least able to protect themselves. Nous adaptons notre approche à l'égard de cette pandémie au fur.
Our approach to this disease is evolving as the pandemic evolves. We will use our testing resources to protect those who are working hard to protect us and those who are least able to protect themselves.
The decision on who to test takes into account many factors based on national guidance, local epidemiology, which just means the type of transmission we're seeing, the age group that we're seeing it in, and how severe the cases are, risk to those most vulnerable, so in closed institutional settings like nursing homes, hospitals, etc., laboratory resources and supply constraints. Now that community transmission has been confirmed, our testing will shift to give priority to the following groups: symptomatic healthcare workers, staff of long-term care facilities who provide direct patient care, hospitalized patients with respiratory symptoms and no other diagnosis, residents of long-term care facilities and other vulnerable communities such as nursing homes. In addition, we will continue to test symptomatic travelers from outside of New Brunswick, and obviously anybody who has severe symptoms and has seen their family doctor and their family doctor would like to have them tested. Our continued emphasis will be on ensuring that testing remains timely, accurate, and effective. COVID-19 will not respect our protocols. In this current situation, there will be cases where infections will occur outside of these groups. And again, I just want to caution people that you can have very, very mild symptoms and be very contagious. So it is really important that if you're not feeling well, you need to stay home. And you need to stay home unless you're going out for anything essential as well, even if you're feeling well. Therefore, it is vital that every New Brunswick be on alert for the symptoms of COVID-19, a new or exacerbation of a chronic cough or fever for themselves and for their families, use of self-assessment tools at the GNB website for guidance, and contact 811 if you have symptoms. If you have symptoms of COVID-19, you must act as if you have COVID-19. That means isolating yourself immediately for at least 14 days. Do not put others at risk by behaving as if you do not have the disease. More than ever, what you do matters. What each of us does matters. It remains within our capability to slow the progress and limit the severity of the COVID-19 outbreak. Plus que jamais, ce que vous...
More than ever, what you do matters. What each of us does matters. It remains within our capability to slow the progress and limit the severity of the COVID-19 outbreak. Thank you.
Good afternoon. Bonjour. Over the past few weeks, New Brunswickers have had to adapt to a very different way of life. We have all had to make difficult choices. We have not been able to see our friends and our loved ones in person as we are used to doing. We've had to drastically change our daily routines. Many of us are now working from home. For many residents, these changes have led to financial difficulties. Nous avons tous eu à faire.
We have all had to make difficult choices. We have not been able to see our friends and loved ones in person. We have had to drastically change our daily routines. Many of us are working from home. For many residents, these changes have led to financial difficulties.
I'm pleased that as of noon today, workers or self-employed people in New Brunswick who have lost their job due to the state of emergency can apply for an income benefit of $900. This will bridge the gap until federal EI benefits are available. The application form is now available through the Department of Post-Secondary Education, Training and Labor's website. Application for the annual benefit to assist low-income seniors in New Brunswick will be available online or by calling Service New Brunswick starting on Wednesday. Most New Brunswickers are doing the right thing by obeying the emergency order and staying inside as much as possible. They are only leaving to purchase groceries and other necessary items. Here in New Brunswick, we made the tough decision to implement these measures early on. Taking action before we're experiencing a full impact of the pandemic may have seemed extreme at the time, but I know it was the right thing to do. We are under a state of emergency, and we are entering our third week of widespread closures for schools and businesses. Ici, au Nouveau-Brunswick, nous avons pris la décision.
Here in New Brunswick, we made the tough decision to implement these measures early on, taking action before we were experiencing the full impact of the pandemic, and it may have seemed extreme at the time. But I know it was the right thing to do. We are under a state of emergency, and we are entering our third week of widespread closures for schools and businesses.
From the beginning of this pandemic, we have acted decisively in the best interests of all New Brunswickers. We've had to make decisions based on the assumption that everyone is potentially a carrier of the virus. This has meant closing schools, declaring a state of emergency, forcing businesses to close, ensuring people do not gather in large groups, and setting up checkpoints at our interprovincial borders. These are tough actions, but they were necessary. We've heard some people ask where the specific cases are and who exactly has been diagnosed. The reality is we have to continue to act like everyone around us could be ill. This is exactly how our government has responded to this crisis. We took these actions earlier than some jurisdictions because we saw what happened all around the world in places that waited too long to react. I want to thank Minister Carty for his early warnings and foresight of the pending pandemic, which resulted in the quick closures of our schools, even before the first case was ever detected. In the days and weeks ahead, we will see the impact of these early actions. I am hopeful they will have the intended results. Many people and businesses have taken the situation seriously from the very beginning, and they've done their part to help keep us all safe. I've been impressed, as always, by the innovation of New Brunswickers. I've heard some incredible stories of people exploring new ways to work remotely. Plusieurs personnes et entreprises ont pris.
For many people and businesses, actions have been taken seriously from the beginning, and they have done their part to keep us all safe. I have been impressed, as always, by the innovation of New Brunswickers. I've heard some incredibly stories of people exploring new ways to work remotely.
Businesses are using contactless options like curbside delivery to drop off everything from pet food to pizza. Local shops are embracing online sales. Businesses that provide classes, counseling, and other services are offering video options to their clients. I want to thank workers at grocery stores who are doing so much to make sure we are well supplied with the items we need, while also helping to keep us safe. They are sanitizing their carts and shelves, following physical distancing rules by reducing the number of people allowed in their stores at one time, and helping deliver food to people who are self-isolating. I also appreciate that many grocery stores have introduced special hours for the elderly and other vulnerable people to do their shopping. I want to thank all of those who are finding ways to make things work. It isn't easy, but we have to continue to embrace this sense of innovation to keep everyone safe. Unfortunately, there are still some exceptions. While most of us understand that we are under a state of emergency, there are still people disobeying the emergency order and putting us all at risk. There have been stories in the media over the past week about people engaging in unacceptable behavior that puts residents, essential workers, and first responders in danger. We all have a responsibility to keep each of us safe, and we all need to take that responsibility very seriously.
While most of us understand that we are under a state of emergency, there are still people disobeying the emergency order and are putting us all at risk. There have been stories in the media over the past week about people engaging in unacceptable behavior that puts residents, essential workers, and first responders in danger. We all have a responsibility to keep one another safe.
We continue to monitor our province's borders and screening every vehicle that attempts to enter the province. Public safety officers have checked over 2,500 vehicles attempting to enter New Brunswick to date. This includes 1,687 commercial vehicles and 210 vehicles carrying New Brunswickers who were instructed to self-isolate for 14 days. Unfortunately, officers also found 93 vehicles that were attempting to travel unnecessarily. These vehicles were turned away. Public safety officers have initiated 250 investigations into non-compliance under the state of emergency declaration. We have listened to the advice of public health now more than ever. Please stay at home. Follow physical distancing practices when you must go outside. This is the only way we will be successful in flattening the curve. Je vous prie de rester.
I'm asking you to please stay home. Follow physical distancing practices when you must go outside. This is the only way we will be successful in flattening the curve.
And do your part to keep everyone safe. Thank you. Merci.
Premier Dr. Russell. Now proceed with questions from the media. We'd ask each journalist to limit themselves to one question, and you're invited to ask questions in the official language of your choice. Nous allons maintenant procéder aux questions des journalistes.
We are now going to go to journalist questions. Please note that you have one question and you can ask your question in the official language of your choice.
Oui, bonjour.
Hello, this question is for the Premier. You say that you've investigated 250 cases by public safety. Can we expect more fines or more severe measures that will be imposed in New Brunswick? For example, will people be forbidden to travel between regions?
Michelle, if we're getting some patterns that we can watch. I mean, the routine travelers for essential services or business functions that are allowed. But should we see a continued, let's say, a continued violence or non-compliance of the rules, then fines will be implemented. We will charge individuals because we will enforce compliance. This is a matter of health and safety to not only the individuals that are in non-compliance, but to the many people that they might come in contact with.
Merci. Vicki Hogarth, Charlotte County TV.
Thank you, Dave. My question is for Dr. Russell. How are you ensuring that seniors who receive home care are getting the same number and quality of visits, and what precautions are the agencies taking, and what emotional support is being provided to help them cope with isolation?
So, in terms of anything directly from a public health perspective that I have been involved in, I don't have specific information around that other than the general pieces of information on our website around mental health resources and suggesting people that to access that. So my understanding would be that anybody who is going into the home of somebody who is in a vulnerable situation, that they would be following the same protocols that we would have encouraged anybody else to in this situation.
Thank you. Charles Comidon, TVA.
Oui, ma question.
My question is for Premier Higgs. with the control checkpoints in New Brunswick borders, you mentioned earlier in your presentation how many arrests were made for people who were trying to enter the province illegally. And my sub-question is, these checkpoints are managed by the Department of Natural Resources. Why isn't it the RCMP or the police, for example?
So the first, I guess, second part of the question was in relation to who is enforcing it. So it's a combination of RCMP, public safety officers. We're utilizing resources that this being our priority, so we could have people from Department of Natural Resources and public safety, EMO officials. So we're using a broad perspective or range of people. And the other part, in terms of charges, at this point, I'm not aware of any particular charges being laid, although for the people that were turned back, so they have gone back out of our province. The others that are in isolation right now, we have follow-up numbers. We know where they are. We're calling them, checking on them. And so if we find cases where they are not following their isolation, then we would go the next step with charges.
Kevin Bissett, Canadian Press.
For Dr. Russell, I wonder if you could provide a little bit more detail about this employee at Shoppers Drug Mart and talk about how the stores would have been dealt with to make sure that they're safe again.
So I will, it's hard for me to speak to individual cases with respect to the investigation, but in a broad sense, each and every case that public health investigates will be followed up with the exact same way. So the close contacts would be traced. If there is a risk of exposure to co-workers, et cetera, that would be addressed with whatever organization they're involved with. And then if there is a public exposure that we need to announce publicly, then that's what we would do. So each case is treated exactly the same in terms of the approach for people who may be at risk or who may be close contacts. And my understanding is that in this particular situation, there was cleaning recommendations, and they were acted upon.
Elizabeth Fraser, CBC.
Hi, sir. My question is for the Premier. Over the weekend, New Brunswickers traveled to places like St. and New River Beach, and we understand the authorities were called to these locations. Will these people be receiving fines for being in close proximity with others, even though they were outside? And what is your reaction to people congregating in these areas?
It's disappointing at the very least. You know, I know when the weather is nice after a winter, people want to get outside. And they just, for some reason, don't appreciate the exposure that they have to themselves, their family, their neighbors, their friends, or complete non-acquaintances because they're putting themselves in harm's way. So that's very disappointing. The case at New River Beach, we are aware. I was told that there were over 100 cars at that beach. We have notified the authorities. There won't be 100 cars there in the future. And the beaches and parks are closed. The playgrounds are closed. We have any areas where gathering points would be normally are closed. People need to understand that, and we will enforce it. So again, I'm not aware of anyone that was handed fines this past weekend, but I assure you, if there's a lineup of cars there in the coming days, there will be fines, there will be warnings, there will be tickets, there will be enforcement. Because we are not going to continue to let this pandemic spread throughout our province because some people refuse to take it seriously and are allowing others to be at risk because of it.
Thank you. Silas Brown, Global News.
Hi, Dr. Russell. I'm wondering if you could tell us how many cases are currently being investigated as potential community transmission.
Well, I can tell you there are several in several regions. And so because it's in several regions, we're sort of saying it's all over the province. So because there are no travel restrictions between different places in the province, there are now travel restrictions for people coming outside of the country and for people coming from outside of the province. So we do expect there to be community transmission that happens all around the province, again, because we will see a shift from travel-related cases from outside the country and outside the province. And so the community transmission that we expect to see will be all around the province.
But do you have a number for how many of these are being investigated as possible community transmission?
Well, my message, Silas, is that no matter where you are in the province, you have to assume that it's there, and you have to assume that you have it, and you have to take all the precautions that I've already recommended and follow all the protocols and measures that are already in place today, because that's the only way that we can minimize the transmission and minimize the risk to our healthcare system and our healthcare workers.
Andrew Waugh, Telegraph Journal.
Yeah, Dr. Russell, just following up on Silas's question there. Whenever we seem to ask for numbers, we get these very vague answers about several cases in several communities. Do you think that not providing specific numbers and more details is undermining New Brunswickers' faith in how the government is handling this?
I hear what you're saying. Both you and Silas have concerns about where the community transmission is happening, and I can appreciate why this information would be of interest to you both, as well as New Brunswickers in a general sense. And again, I'm trying to make sure that people don't have a false sense of security if I say, well, it's in this area, but it's not in this area, when I can't say for sure that it's not in every area. I want everybody to feel protected. I want everybody to take the same precautions no matter where you are in New Brunswick. It's almost more important now more than ever because we know that community transmission is happening, and I really, really want people to understand that all the measures that are in place right now are really, really important to follow, each and every single individual in this province.
Thank you. Brad Perry, CHSJ.
I know this message, or this question rather, is for Dr. Russell. Now that we do have this community transmission, we do this confirmed community transmission, I know you've been saying all along that people should act like COVID-19 is in their community. Do you think this will change the attitudes of those New Brunswickers who maybe, don't have any concerns about this? Do you think this will put a little more pressure on them to realize how serious the situation can be?
Well, I think, again, we're trying to provide as much information as we can for people to use to protect themselves. So to the best of our ability and the best of our knowledge with what we know is happening across the country, what we know is happening globally. Again, we are trying to give people the knowledge and the power to protect themselves. And at the end of the day, how well we do that and how well people receive that information and how well people act on it, how specifically people follow those instructions will be reflected in our numbers moving forward. So we will definitely see a result of the actions that we have taken. If everybody in New Brunswick follows that advice, we will definitely see that translated into lower number of cases, lower number of people admitted to hospital, lower number of people needing ICU beds and support. So I think that everybody in New Brunswick should feel confident that they have the information that they need to protect themselves at this point in time.
Thank you. Laura Brown, CTV.
Hi, Dr. Russell. I'm looking at Nova Scotia's press conference right now, and they're reporting the first case of community transmission in Nova Scotia. I'm wondering, of the 23 cases that have been announced in New Brunswick Saturday, Sunday, and today, I don't need to know the zones or the ages, but I'm wondering, of the 23, how many are you investigating as a community transmission? I don't need to know where it's at because I know you don't want people to have a false sense of confidence. But I wonder how many you are investigating as community transmission.
So in terms of how we'll be reporting moving forward, just as you see at the national level, those numbers are available in terms of percentages of, so 100% of our cases up until, very recently were travel-related. I think we would very confidently be able to then start reporting on the percentage of community transmission cases. So I think that's not a hard thing to communicate with people moving forward. So I am very confident that we can move in that direction, so you'll know the percentage of cases that are travel-related and the percentage of cases that are community transmission, because again, we expect to see the pendulum swing from travel-related cases exclusively to mostly the majority being community transmission. But again, the measures that are in place right now and the actions that each individual New Brunswicker takes right now will determine how these numbers evolve.
Cédric Thévenin, Acadie Nouvelle.
Oui, bonjour, c'est une question.
This is a question for the Premier. I understood that there would be fines. Forgive me, I'm mixing up my words. What additional measures or restrictions could be imposed in the next few days to avoid community transmission?
I think it's important to realize, we have a team effort here, and certainly Dr. Russell looks after the testing and understanding where our risks are and what measures we need to take in further testing to ensure that we understand the size of this pandemic. Certainly the role that I'm working with public safety is how do we enforce those measures? How do we put the necessary restrictions on the public to ensure that they are compliant? That could mean anything from the initial warning, the further fining or charging, and it could move right through to as high a fine as $10,000, over $10,000, and if in extreme cases it could lead to confinement. We will continue to ramp this up in terms of enforcement to ensure compliance.
Merci. Monique Lausier, Radio-Canada. Hello, Jordan Gill, CBC.
Yes, this question's for Dr. Russell. Did Shoppers Drug Mart tell you whether it was a pharmacist who tested positive for COVID-19? And what are you telling people who are actually in the pharmacy on those days and times? Are you telling them to self-isolate or just to monitor their self for symptoms?
Again, my regional teams look after the individual follow-ups for these cases, so I don't have, and for confidentiality reasons, I wouldn't speak specifically about it other than to say that the publicly announced times that people were there, my understanding is that they should be self-monitoring, but obviously everybody in the province who's not an essential worker should be, at home as much as possible. So, and the advice from public health for the close contacts would be to self-isolate.
Thank you. Geneviève Normand, Radio-Canada.